Hey, wow, VIPers, and welcome to another daily edition of Update. My goal with all this is to make you the most informed community, the most informed group of folks about all the craziness that's going on, and informed because you're getting curated, accurate information. That's my purpose while I'm out of the office, and as you can see, I am out of the office. I'm in my casual wear. But again, our goal is to provide you curated, scientifically sound information to try to make you a panic-free group. That's my goal, is for you to take this information and spread it far and wide. Let folks know, whether they're part of this group or not, that you're the most educated group of folks out there, because we're cutting through the BS. This is a no BS zone, as one famous broadcaster used to say. Or maybe that was the no spin zone. Well, regardless, we're giving you information today on a couple of things. One, a very, very special event that's coming up this Thursday. And then we're going to talk a little bit about COVID-19 and pregnancy. I've been getting a lot of questions about the impact that this has on pregnancy. And even though I'm not delivering babies anymore, I still know a good bit about it. Did it for 30 years, so it's still pretty fresh in the old noggin about pregnancy. So we're going to touch on that in a few minutes. But first, I want to remind you about a very, very special event coming up this Thursday in the time slot that we normally are going to do our Facebook Live. I've been getting a lot of questions over the last few weeks about how to deal with stress, and in particular, stress and eating. That seems to be a real issue for a lot of folks, and myself included. I'm not excluding myself from this, but especially a lot of you folks in the community have said, how can we deal with some of the stress eating, the emotional eating that goes on when we're thrown out of our normal environment? Well, I heard that, and I know a little bit about that, but I'm not an expert. So what did I do? I found an expert. I went out and found someone who actually I discovered initially on my daughter's podcast, and I was so impressed with what I heard, I wanted to bring her knowledge and expertise to you. Kristen Jones is a best-selling author. In fact, here's her book right here. Can you see that? And it's subtitled, When Food is Your Drug, A Food Addict's Guide to Managing Emotional Eating. Well, she's going to be with us Thursday. Actually, in full transparency, she's going to not be live because, I hate to admit this, but I'm kind of technically a dork in some instances, and I haven't figured out yet exactly how to branch this, having someone live and bringing it into the Facebook Live. I know there's a way to do it. She actually told me there's a way to do it, but I haven't figured it out with what I have available to me now. So what we're going to do is we're going to record the conversation, but we're not going to record that till tomorrow evening. So if you have questions, if you have any concerns, if you want an expert's opinion about how to avoid stress eating, how not to gain these extra 10 pounds, how not to make food your master, how to get control of your emotional environment as it relates to food, ask those, either private message me those or put them in the feed, and I'll make sure that we get those to Kristen, that we ask those questions so we can really address your individual needs. So that's Thursday. We're gonna broadcast that, so you're not going to want to miss that. I have it on good authority that she's actually going to give you some special treats that night too. Possibly get access to some of the services that she does. Maybe even get a copy of her book. So you don't want to miss that. Be sure you tune in at our regular time. But if you've got any questions in the meanwhile, shoot those to me, and I'll make sure that those get answered. So either if you want to stay anonymous, shoot that to me in a private message, or just post them down below here, and we're going to make sure we answer those questions. This community is about support. This is about bringing you value. This is about answering your needs. So I'm really excited about being able to draw Kristen in and use her expertise to really provide some exciting, practical tips to avoiding emotional eating during this stress. So let's get to pregnancy and the COVID-19 virus. First of all, let me say that at this stage, and I'm always making that caveat before I talk about things, because literally even information on this topic has changed in the last 48 hours. So I reserve the right to go back and revise this as we get additional information. But as of now, I can generally say that the data indicates that pregnant women, although they may be at slightly increased risk due to any type of viral illness, generally are not at an increased risk for adverse effects from this virus over and above the general population. We know that the state of pregnancy itself can make some women more susceptible to more severe infections when they get the flu or when they had SARS or MERS. That's what we have to go on by our previous experience or other coronaviruses. It's not that they are naturally set up to be more susceptible. It's just that a slight increase compared to the general population may have a more severe impact, like a pneumonia. But there's not a greater percentage. In fact, some of the data indicates a less percentage of mortality. We've not had to date, any maternal mortality deaths here in the U.S. In China, I believe they had, or maybe it was Italy that had one. But the death rate from this is much lower than the general population, largely because these are young, healthy women. So that being said, just to reassure you that there's not any real great danger to the mom. And let's think about pregnancy too. We're thinking about two patients. We're thinking about mom and we're thinking about baby. So when it comes to mom, obviously what happens to mom impacts baby, but we'll talk about the differences there. When it comes to mom's health in general, just be smart about, like you would in any scenario right now, doing exactly the same thing that everybody else is doing. The physical distancing, the hand washing, wearing the masks when appropriate, avoiding contact with known people who have the virus. Pregnant women ought to be doing just exactly the same thing that everybody else is doing. There's no additional extra super precautionary things that they need to be doing. Let's talk a little bit about the baby. As of today, there are no studies that indicate that the virus is transmitted to the baby while the baby is in the womb, while the pregnancy is ongoing. There have been studied what we call cord blood, which is the blood that's taken out between the placenta and the mom. There's amniotic fluid. There's testing babies immediately upon delivery. And there's no evidence that this virus is being transmitted across the placenta. Now, that's important for a number of reasons. Most importantly, in women who are in early pregnancy who worry about, well, could this virus cause birth defects or premature congenital defects or even spontaneous miscarriages. Well, the data indicates at this point, no. It does not seem to be creating anything like that at all. We are seeing that it possibly, if mom gets ill, if she's one of those people who does get it and does happen to get more ill, then potentially it could trigger an immune response which might cause preterm contractions or preterm labor. There are a couple of instances where women who tested positive for COVID-19 who were actually in labor had some respiratory difficulty that created the condition called fetal distress, which required a C-section. So again, we're going largely on anecdotal information. We can't even say that those instances were simply due to the infection. It could have been due to a number of things. I mean, our C-section rate in this country right now is 35 to 40%. So there's obviously a number of things that can go on during labor that can necessitate that. So we just don't have enough experience to know yet, is it strictly something due to COVID-19? In general, and this is the blanket statement, is we know that pregnant women in general tend to get a slight increase in their propensity to develop complications like pneumonia. I mean, maybe 1 or 2% over the general population at most. Number two, there doesn't appear to be any placental transfer. So there's no concern at this point about miscarriage or congenital birth defects or anything of that nature. The third question we get a lot about is, well, what happens in a mom who is COVID positive who delivers? And what happens with the baby? Well, yes, there has been some evidence that the mom who is positive and delivers can transfer that to the baby. So there are precautions that are already in place in the hospitals. They're very aware, they're up on this to try to minimize the potential spread. And that's really in people who are tested positive. We are being more aggressive in testing pregnant women for that reason. So maybe a pregnant woman might be more likely to get tested. We're not universally testing people, just like we're not universally testing everybody else. But the bar to test pregnant women is a little bit lower just because we know we're also dealing with the baby. So precautions are made once that baby's delivered. Interestingly, we're seeing that the COVID-19 is not transferred in breast milk. And this is based on recent studies out of China and in Italy and even some here in the U.S. And also based on some studies that we've seen from previous coronaviruses that were studied, such as MERS or SARS. There doesn't seem to be breastfeeding transfer of the virus. So right now the CDC is recommending that mothers who are positive for COVID can breastfeed their babies if they take the necessary precautions of wearing a mask, doing hand washing, doing washing breast pumps, etc. And that's really an individual decision as to whether to do that. Obviously, there's tremendous benefits of breastfeeding over and above anything we're talking about here. So just know at this point, that's still a possibility if you are positive while you go into labor and delivery. Another question we're getting a lot is, what are the policies with regards to visitors and if someone comes in labor, who can be in there with them? And quite honestly, that is region to region. Literally, that's hospital to hospital policy. Right now, currently at University Hospital that I'm most familiar with, they are limiting it to only one significant other, whether that's the daddy, the husband, or just one significant other. Hopefully the daddy or the husband or the significant other are all the same person, but if not, who knows. But only one additional person is allowed into that labor and delivery room. I know there's some places in the country that have actually even stopped that. And I mean, I can't tell you right now if that policy will change here. I'm just saying as of March 31st, that's the policy at University Hospital. Trying to think if there were any other questions that I were getting with specifically as it relates to, there has been a question about, and this is one of the things going around the internet about home births. Is it safer now with people in the hospital having COVID-19, is it safer to deliver at home? Well, my answer is no. But there are, this is my own bias, and I can be brutally honest about that because I don't do OB anymore, so I don't have any dog in this fight. But after 30 years of doing this, I know, yes, labor and delivery is a normal, natural event, and most people go through it with absolutely no problems or complications. But when something happens, it can happen quick. And it can go south quick. And for my money, you want to be in some place that can handle that more effectively than being at a teepee in your backyard or at home. Now, that's a personal choice, and everybody has to make that decision. And there's not any evidence that being in the hospital in labor increases the chance of someone who doesn't have COVID-19 of contracting it. So I think with the evidence that there have been some people who have COVID-19 who get into complications with their breathing a little bit more than someone who doesn't, which then would necessitate intervention in the baby, I think it only makes sense to be in a setting where that can be taken care of in a medically efficient fashion. And that's a whole different subject for a whole different day as far as home births and that kind of thing. But I think if you are making a decision and you wanted to do a home birth, you make that decision completely separate from what's going on with COVID-19 at this point. If you were going to do a home birth before, do a home birth after. If you're just now thinking, oh, because of all this and these people are in there and they're screening, that's why I should do a home birth, my recommendation is no. It's just not, there's not any benefit and there's plenty of potential risk. All right, that's enough for today. Again, don't forget, if you've got some questions about emotional eating, shoot those to me. Mark it on your calendar for Thursday evening when we're going to broadcast that interview. I think it's going to be incredibly valuable. And until I want to say tomorrow, I'm not sure based on our schedule. We do have some updates on our office scheduling coming up, and I'm going to broadcast those out here to everyone pretty soon. But for right now, hopefully tomorrow, make healthy choices.